From 1850 through 1944, our healthcare system began getting off the ground with attempts to establish a healthcare system that works for everyone. It was attempted and failed by both Presidents Theodore Roosevelt in 1902 and Truman in the 1940s. Unfortunately, in 1945, we would make our biggest mistake in healthcare policy. The McCarran-Ferguson Act, signed into law by FDR, giving health insurance companies an exemption to the Antitrust Act. This means they are permitted to engage in business practices that are otherwise illegal, in the industry we can least afford it. A society and its economy can only be as healthy as its driving population. The effects of this decision were felt immediately as the price for hospital care doubled over the next decade. Our first big step forward in healthcare came when the War Labor Board declared sick leave and the healthcare insurance as non-taxable income in 1954, resulting in a significant increase in benefits. In the 60s, the number of companies offering healthcare insurance grew to over 700. President Lyndon B. Johnson on July 30th, 1965 made a big advancement with the passing of the Burton Act, establishing the Medicare program. In 1974, President Richard M. Nixon made a failed attempt at establishing a universal health coverage plan. In the 1980s, President Reagan shifts Medicare payments from treatment to diagnosis, with private plans quickly adopting the same policy. A system that combines both factors is the only compensation scheme that will work. In 1993, the Clinton healthcare plan fails to be enacted into law as healthcare costs rise at double the rate of inflation, followed by multiple pieces of backsliding legislation by George W. Bush. Obama stated that it should be, quote, a market where Americans can one-stop shop for a healthcare plan, compare benefits and prices, and choose the plan that's best for them, in the same way that members of Congress and their families can. None of these plans should deny coverage on the basis of a pre-existing condition, and all of these plans should include an affordable basic benefit package that includes prevention and protection against catastrophic costs. I strongly believe that Americans should have the choice of a public health insurance option operating alongside private plans. This will give them a better range of choices, make the healthcare market more competitive, and keep insurance companies honest. Healthcare was a major part of Barack Obama's campaign promises, and while he admitted that only a single-payer system would provide universal coverage, the plan favored by Obama would be to increase insurance coverage instead. There is no public option or anything like it in the Patient Protection and Affordable Care Act. The U.S. health insurance market is highly concentrated, as leading insurers have carried out over 400 mergers from the mid-1990s to the mid-2000s. As a result, the nation's largest 5 health insurance companies posted a 56% gain in 2009 profits over 2008. The U.S. Department of Justice has recognized this percentage of market control as conferring substantial monopoly power in the relations between insurer and physicians, while inducing some $350 billion per year in unnecessary expenses that reduce delivery and quality of care. This proves two things. Consolidation is the most effective model, and short-term profit over people is devastating to our country as a whole. The public option, if run properly, simply forces private companies to do good business or find something else to do. The implementation of the program would bring about a truly competitive marketplace that continually strengthens a universal-type healthcare system, providing a product that truly works for the consumer, with reduced burdens on employers and individuals on many fronts: financial, health, job creation, and relocation, and a huge lift on the medical suppression of advancements in treatment and technologies. As this shifts the focus on preventive care, expediency of recovery, and cures to reduce overhead rather than the system we currently have that rewards the worst practices. Health insurance exchanges and the individual mandate requirement for all citizens to purchase health insurance without a public option and an exemption to the Antitrust Act in place. We are giving the monopolized industry a free advertising outlet and boosting their profits while reducing care. This is already evident in the rapid erosion to the Medicaid program due to piss-poor government regulations, and greedy doctors are failing those it is intended to serve miserably. The model of the cheapest route taken every time, especially in life-threatening progressive medical problems, will never work, and copays requirements for recipients defies the purpose of the program, is cruel and an embarrassing disservice to us all. A public option type approach to healthcare, government funded and regulated while privately ran for a balance between the two. This addresses cost while keeping a direct humanitarian aspect to decision and policy making. A small monthly mandate requirement to maintain the system and sense of personal responsibility, while working with both government and private entities, guarantees competition, innovation, and continuous improvements in products and services. Proper healthcare policy outlines priorities and defines a vision for the future. America can never prosper until this ever-worsening problem is solved. The U.S. must ratify the social and economic rights sections, including Article 25 of the United Nations Universal Declaration of Human Rights, asserts that medical care is a right of all people. UDHR Article 25, quote, "Everyone has the right to a standard of living adequate for the health and well-being of himself and of his family, including food, clothing, housing, and medical care, and necessary social services, and the right to security in the event of unemployment, sickness, disability, widowhood, old age, or other lack of livelihood in circumstances beyond his control." Enact the Antitrust Enforcement Act. Hold health insurers and medical malpractice insurers to the same good competition laws that apply to virtually every other company doing business in the United States. Enact the United States National Healthcare Act, H.R. 676, with the following minimal modifications. Must have some type of relatively small mandated minimum premium, at least in the short run, equivalent to current Medicare rates, $96 a month. This is in need more so as an ease of transition from one system to another, more so than personal responsibility. However, it may prove necessary to keep in place if society proves to be irresponsible. Don't think this will be the case. For-profit organizations cannot be prohibited from operation, nor can they be permitted to influence legislation. Driving innovation and real competition improves services and reduces cost. This is better for both the population and the government. Physician compensation adjustment. As with most services, there is an expected range of acceptable payment for that service. Establish true results based on national averages of successful treatments and outcomes for such services, both in quality, expediency, and real incurred cost. The systems will continuously increase the quality of the overall care for all patients while ensuring the best doctors are rewarded for exemplary service. Establish the USNHC Trust Fund to finance the program with amounts deposited from existing sources of government revenues for healthcare. Use a 15% tax on legalized marijuana and other drugs to fund legislative reforms and a new system. This should prove to be a temporary funding measure for startup costs and implementation, until infrastructure changes have been made to compensate for the cost. In the interim, decisions can be made as to how much of the 15% is to be reduced, and exactly that which remains is used for to further reduce healthcare costs. Must be an all-inclusive merging of all programs or it doesn't work for all citizens. By utilizing a public option type inclusive setup that allows continued for-profit companies, if they can compete, eliminates the need for any delays in implementation other than the time needed to put systems in place to run system effectively. The immediate savings realized would be from the removal of insurance company overhead and hospital billing costs having to do with those private insurances.